Good day! Today I'm going to perform an assessment of skin, hair, and nails return demonstrations. So, the purpose typically includes inspecting overall skin color, inspecting for skin lesions and wounds, and palpating extremities for edema, temperature, and then for the capillary test. Okay, so for the assessment, this structure, functions, and perform a physical assessment for skin, hair, and nails. Okay, now let's start for the procedure. So first, introduce myself to my clients and verify my client's identity. So hello sir, I am Joy Saluya Goto, your student nurse of CSPC. And you are, what's your full name po? Okay po, ilang taon na po kayo? Okay, so taga saan po kayo? Okay, so next is gather equipment. So now, I need to use a gloves and then the pen light and then I need to comfortable room temperature and then adequate lighting. So natural daylight is the best. Okay, so then magnifying glass if available. Okay, so after that, explain to the client if what I'm going to do. So, sir, later on, I will ask you some questions and I will inspect and palpate you. It is okay for you po? Okay. So, next is provide for client's privacy. So, assume that we have a curtain and close it. And of course, we need to close the door to have a client's privacy. So, after that, then perform hand hygiene. So, I already performed hand hygiene. Okay, and then ask the client to wear gown. Okay, so, sir, this is your gown. Please wear po. Okay. So, inquired for client's health history. So, sir, I will have a question na po. So, let's start po. So, for your past history, for current symptoms po, in a skin problems, like, do you have a skin rashes po, lesions? Okay. Dryness po sa inyong skin? Okay. And then, oiliness? Bulisir or pagpapasa po? Okay. So, pangangati po o body odor? Okay. So, how about sa hair loss po? Meron po ba? Okay po. Sa nail po, may changes po ba sa nail? Okay. So, for your family history, sa family history niyo po ba, meron po bang nagkaroon ng skin problem or skin cancer? Or skin... Okay, so, for the lifestyle and health practices po, nagkaroon po ba kayo ng exposure sa sun or sa other chemicals po? Okay po. So, sa daily care of skin, hair, and nails po, meron po ba kayong daily care na ginagawa? Okay, so you are taking a bath lang po? Okay po. So, then, after that, now let's proceed for the assessment. So, let's start for the assessment of the hair. So, okay, before that, I need to wear gloves. Okay, I'm done wearing my gloves and now let's start for the assessment of the hair. Okay, inspect and palpate for the color, amount, and distribution. Okay. So, for the thickness and texture, oiliness, lesions, and parasite. Okay. So, sir, wala naman po akong nakitang kahit ano, mga parasites po sa inyong buhok. And then, never pa po ba kayo nagpapakulay ng buhok? Okay po. So your hair is natural pa po. So, medyo napansin ko po na manipis lang po ang inyong buhok. But, there is no problem naman po. So, next, for the assessment of the nails. Inspect for grooming and cleanliness. Okay, sir. Okay, so napansin ko po na malinis naman po ang inyong mga kuko and there is no problem po. Okay, and then for the inspect for the color and markings and for the shape. Okay, so yung kuko niyo po siya, sir, okay naman po siya. And then, hindi naman po iba-iba yung shape ng inyong mga daliri. And then, okay, so, and then next is palpate texture and consistency. So, test for capillary refill. Okay. Press the nail tip briefly and watch for changes for the color. Okay, sir. After palpating your capillary refill, naobserbahan ko po naman, madali po siyang bumalik and there is no problem naman po. And wala naman pong mga kahit anong nakaangat sa inyong kuko po. So, okay. So, let's proceed for the assessment of the skin. Note all distinctive odor and then inspect for generalized color variations and then skin breakdown. So, sir, okay, so wala naman po ako nakita ng skin breakdown. Okay, and then yung color niya naman po is light brown, so it is okay po. So, next is inspect for the primary, secondary, and or the vascular lesions. Okay po, sir. So, wala naman po ako nakita ng kahit anong primary or secondary or vascular lesions. So, next is palpate lesions. Okay, and then palpate for texture. So, this time I'm using the palmar surface with my 3 fingers. Okay, palpate for texture. Okay, so, wala naman po akong naramdaman ng kahit anong texture. So, next is palpate for the temperature and moisture. So, this time, I'm using the dorsal surface with my back of the hand. Okay, sir. Sir, can you please write the code? So, thank you, sir. So, yung temperature niya naman po, hindi po kayo mainit o malamig. So, warm naman po. So, wala po yung problema na may sakit man po kayo o naman. So, next, palpate for the thickness of the skin by using my finger pads. Thickness of the skin. So, okay, thank you, sir. So, next is for palpate for mobility and turgor. So, okay. And then next is palpate for edema to 5 to 10 seconds. Okay? So, I don't have to see any edema. So, kapag pinunch ko naman po siya, bumabalik naman po siya sa dati. So, okay. So, So, thank you very much for your cooperation po, sir. So, ang may advice ko lang po sa iyo is take your medicine po, like your vitamins, if they're have po, and then drink water po to stay hydrated. And of course, do an exercise po, okay? And then eat healthy foods. So, that's all lang po. Thank you. Thank you for cooperation po. Okay, so after performing an assessment of skin, hair, and nails, so now I need to discard my used gloves. Okay. Okay, so that's all po. Thank you.